Hey there, it's Dr. Brian McKay, Core Health in Darien, and founder of the Back Pain Project. Now, COVID 19 has dealt us a number of serious blows. The one that I deal with mostly is people coming in here complaining of more lower back issues because they're sitting in front of a computer for nobody's working pretty much less. I think there's lack of a commute, which is a damn good thing. People usually sit, you don't get much work done. But I actually think that people are actually continuing to work um, pretty hard. I mean, some people are, you know, taking a conference call in bed. Um, you're sitting on the couch. But what is happening is backs, from a biomechanical standpoint, are very weak to begin with. There's a lot of muscles there, and the amount of sitting that we do compared to parents and grandparents is tripled, if not at least doubled. And so what this happens is putting strain on our bodies. Um, you know, there also has been a lot of closures of health clubs. Fortunately, people are going through, in droves, going to Peloton, which, man, don't you wish you had that stock a while back, before this pandemic hit? But the idea here is there's a lot more low back pain. I'm sure you're aware of it. Um, you know, people neck pain is getting there too from craning. I mean, most people working off a laptop at their desk, not the big screens or the ergonomic chair that you have at your office, your regular office. So we're seeing a big surge in the number of cases of back pain. Now, what do you do about it? Well, as a chiropractor, I'm going to say get your back adjusted. Some people go for massage, some people are going to go for physical therapy, and those all work many times, and they do a great job. But we're talking about more of the lower level type of things. Now, if you've got a chronic low back problem, and now you find yourself sitting and your back hurting, your neck getting tight, and your butt going numb, well, it's probably not going to go away on its own. And if you really think a mechanical problem is going to be solved with a pill, guess again. That's like saying, um, you have a bad carburetor, and you can change the oil. You can do something extrinsic to fix an intrinsic problem. It's just not going to work. I think you know that. So, why would you go to a physical therapist? Well, you're going to get stretched, hopefully. You're going to get some muscle stim, going to work out those knots, probably more effectively than a massage therapist. Now, listen, massage therapy feels good. Maybe you should do all three. I mean, I know that's one of the things that we do in our office. We do physical therapy, we do chiropractic adjustments, and we do massage. So that's some people do not want one or the other, or they want two out of three, or none of the above. But I want to talk to you about some really new, first of all, a treatment called spinal decompression. A spinal decompression, I've been doing spinal decompression for over 20 years, probably closer to 22, 23 years now. And spinal decompression is a way of opening up the joint space and allowing cerebrospinal fluid to go into the disc space and really rehydrate the disc. Now, doesn't sound too great, but it's a fantastic treatment. Let me tell you, it's something that you can't do on your own. People go, "Can I buy one of those inversion tables?" And the inversion tables are a long axis traction, so you're taking pressure off the nerve root, but you're not getting the milking action that a spinal decompression treatment offers. What I mean is it opens up, it creates negative pressure within the disc space, and it lets the fluid go in and rehydrate the disc. So a desiccated disc is a term we apply to a disc that's dehydrated. You know, yeah, desiccated liver, desiccated banana chips. Well, the fluid's taken out, and you can have a tremendous turnaround with spinal decompression. Fortunately, I'm actually excited because we're on the latest generation of spinal decompression we have now at the office here. And it's one of the main things with the back pain project. And what it does is now better programming, more customized treatment plans are available. Say you have a right sided herniation. Well, we can nail that right sided herniation by programming the machine to do a lateral pull from the right to decrease the wedging that occurs in the disc space. So it's really a fantastic treatment. It's comfortable, takes about 15 minutes, but more than else, I think it's very effective. Now, when you're at home, the one thing you could probably do is if you are in pain, get on your hands and knees, roll over on your back, okay? Bring your knees up and just roll your knees side to side, okay? With your feet firmly on the ground. And just go see how far you can go. I mean, it really does. It does open up again, and it's going to get some fluid moving in there, because if you're sitting for periods of time, you need to get up and move around. Now, if I'm just going to say you're probably doomed to have a bad back the rest of your life. And again, Advil or Aleve shots are not going to cure it. You'll get some short-term relief, but you're not going to get the long-term relief you need. So let's take a look at the biomechanics of your spine. You have discs that separate and cushion and help support. You have facet joints in the back where the weight of the vertebra is supposed to be met. The load is placed on these facet joints towards the back of the spine. Quite often, these facets get jammed, and you start to lose the curve. Probably more due to certain muscles tightening. I would probably point out to the obliques and the multifidi muscles in the lower back. These aren't big muscles, and they're kind of rotators. So when you lose mobility, you're going to have more pressure on the disc. Hands down, you have a lot more pressure on the disc. So what we need to do is get in there and stretch those multifidus muscles out with a process called trigenics. Now, trigenics is not it's really not a chiropractic treatment at all, but as a chiropractor, I use it because it allows me to diagnose whether or not you have let's just use the left multifidus. Is the left multifidus muscles, are they weak or are they short? And then what's the corresponding muscle on the other side? The agonistic, antagonistic, relationship needs to be explored. And what we have to do is take a look at, if it's weak or short, where is it long and excessively strong? Because that takes it to another level. I mean, if you're going to do a bicep curl, on the end, when you bring it all the way up to curl and you release it slowly, you're going to be working the triceps as well. So that's what I want to impart upon you, is that the agonistic antagonistic relationship is quite valid. And I think if you take it and extend out just to look at the one particular muscle, because it's really never going to be just one particular muscle with the low back. I mean, some of the muscle groups you need to look for, the glutes. I mean, everybody's, the glute max is, pretty big nerve, pretty big muscle, fed off the L5 nerve root. And that one gets played a lot. I mean, it played a lot because of all the sitting we're doing. It's a big muscle group. Now, if you have a problem with your glute max, you damn well better be checking the rectus femoris, which is the leg that goes down the front of your, very front of your legs, because it's called the neurokinetic chain. The neurokinetic chain means if you have a lower back problem, you got to start with some trunk flexors. You better be looking at the psoas and the iliacus and the rectus femoris. And these are muscles that are involved with hip flexion. So if you're not checking these muscles out, well, you're not doing a damn good job. Now, I got to tell you something. Love the Peloton. Like I said, I love the people that are out there exercising. It's fantastic. You can do it at home. You can do it. You can do it on a call if you're really in good shape. No one knows you're pedaling as hard as you are. But the idea is you really need to pay attention to these other muscle groups in order to bring about full resolution. And it's not something that can always be accomplished with just good stretching, because, right now I'm seeing a real upsurge in the number of stretching gyms. I mean, we have Limber over here. We have, Stretch Room. So it's becoming a much more awareness, and people do need to stretch. And quite honestly, when you come to anybody's office, if you're not getting stretched to assist in the overall healing of a bad back, go find someone else who will do the stretching with you, because if you're not, you're just doing the job half-assed, and why bother? I mean, you might be that type of person who enjoys taking Advil or Aleve. There's actually, over the life, people think you just take that stuff like candy, but there is, a number of people take too much Advil or Aleve, or come to rely on it, thinking, okay, that's just the nature of the beast. It does have side effects. Advil and Aleve can really affect the kidneys. So just be aware of that. I mean, you don't want to be popping, hey, I feel good, so I'm just going to continue to take Advil. Well, maybe it's not the greatest idea in the world, but be aware that the strain you're putting onto your foundation or your core by excessive sitting will lead to serious back problems. That's the one thing you have to understand. And 4 out of 5 people are getting it. I mean, we're seeing more younger people um, who are just working from home, and they're not. The ergonomic conditions aren't what they used to be. So in that sense, it's more like beware. I mean, because yeah, it could be a lower back strain that you have, but you get from in your 30s. Yeah, I would say low back pain. A little strain on the muscle. And that's where maybe massage and stretching are going to knock it out. But as we get older, well, say it's a bad case. You have radiculopathy or sciatic pain shooting down your leg. It ratchets it up a bit. Well, now, if you have intermittent pain that comes and goes, I think you got to be aware of the fact that it will lead to arthritis. Now, everybody has an idea what arthritis is. One, pain. Yes, it is pain. But clinically, it's really 3 things. It's pain, lack of mobility, and wearing away the disc or degenerative disc disease, where the disc is being obliterated because the pressure is being put on, undue pressure is being put onto the disc to support. That's not the purpose of the disc. The disc is, I'm sorry, the purpose of the disc is to support, but now it's supposed to be bearing the weight. Not a good idea. That usually comes into play when you have a problem with those facet joints I mentioned earlier in the lower back. So, so what starts out as a strain, muscle strain, then you graduate to improper spine alignment and stability. When you lack stability in the lower back, the body is going to compensate by tightening up muscles, forcing some muscles to become stronger, and some muscles become shorter. That over a period of time leads to pain that cannot be just addressed simply by basic. I'll give myself the hit. Not going to be solved just by chiropractic. It's not going to be solved just with an Advil or Aleve, massage, or just PT alone. So there's a really fantastic way to address the muscle imbalances, and it's called trigenics. And I didn't invent it; I studied it, and I come to appreciate it because I'm seeing much better results with my patients who come in here for back pain and neck pain, for that matter. But primarily, we're talking today about back pain. And what we want to do is we want to create an environment where everything is moving properly to enhance the viability of the spinal biomechanics. And if you can enhance those things and exercise, you're going to have a lot better chance of not having low back pain for the rest of your life. Because low back pain leads to, I call it the pizza beer downward cycle. You have back pain. You don't feel like exercising. You don't feel like getting off the couch. What do? You sit on the couch more, okay? Because it doesn't hurt when you're just sitting there doing nothing. And you pick up the phone, you use DoorDash or whatever, Uber Eats, and you get yourself a pizza delivered, and you have a beer, and you know what? You feel pretty good after a while. You're sitting there. Who doesn't like pizza? Who doesn't like beer? I'm not immune to either one of those. And what happens is we create a pattern, and it becomes a downward cycle. So, what are the takeaways for today's talk? Well, one, if you happen to live in the Stamford, Darien, Norwalk, Canaan area of Fairfield County in Connecticut, well, the back pain project is potentially something if you really want to get over it. It takes about 2.5 months, and 2.5 months, you're receiving some incredibly high-level therapies. It's not just the adjustment, because you will get the chiropractic adjustment. You're going to get the trigenics treatment to balance out all those muscles, which makes it easier on those ligaments, and it takes pressure off those discs. In addition, the spinal decompression is going to be a wonderful way to stretch out internal stretching. I mean, you just can't stretch one particular disc. Spinal decompression can and does much more effectively. So that, and I also want to point out, over a long period of time, you can have, the nerve becomes irritated. Now, something a lot of people don't realize, if they see, pain's pain, right, to you, but those nerves are effective. The nerve, you have 31 nerves on each side of the body. So it makes 62 nerves, a lot of nerves. Now, inside those nerves, it's like a cable. It's not just one nerve. the nerves have you have many different types of nerves. You have a nerve for sensitivity to touch. Um, you have a nerve for pressure sensitivity, light touch, um, burning. So you have all these. So just think of it. Each cable that comes out of your spine at each spinal segment has 9 different functions. 2 are for autonomic control. So this is involved with blood flow. So what you see here is just a little bit more complicated. Hey, I hurt. Um, your general practitioner is going to say, you take a few of these, maybe take a muscle relaxer, and you'll be fine. Well, if your body is tightening up a muscle for a reason to add stability, and you go take a muscle relaxer, what's going to happen? You kind of circumventing the purpose. But the brain knows what it's doing. It's going to tighten. In many cases, I'll point out trunk flexor, iliopsoas, iliacus. These muscles are involved quite often, and people aren't even aware of it. So now I'll use the example. Typically, someone comes in to see me, they're going to have a one-sided involvement with the iliacus or the psoas muscle. Well, if you're really, really serious pain, you can be doubled over in pain. That's when the body just locks that entire pelvis, limiting your pelvic flexion and trunk flexion, and you can't move. Well, what pill is going to take care of you? You're going to go to the emergency room. They're going to fill you up with some medication, send you on your way, and say, hey, go do some PT. Not that simple. First of all, when you have a back problem, it's your back problem. How you want to fix it is another thing. It's your issue. But if you really seek out a practitioner who's well-rounded, make the phone calls. Tell me when to talk to the doctor, because have it explained to you. The more you're explained what's going on, the better informed you can be about the decisions you make as far as your back. But just beware. I mean, and let's really pull it apart. If you're having some serious back problems, okay, and you say you just want to treat it with Advil relief, well, have at it. I mean, seriously, it's doing something. You got to get up and move around more often. So just put a big jug of water. Keep drinking the water, because one, you're going to stay hydrated. I remember before I mentioned about a desiccated disc. Well, a desiccated disc is a dried out disc, more fluid. Now, moving around, you get on your back, bring your knees up, and just go side to side. And don't do it for just a minute. Do it for 2, 3, 4 minutes, and do it several times a day. You're gonna get the fluid to swoosh around, like you were gargling, and swishing a gargle around your mouth. You're gonna get the cerebrospinal fluid to enter the disc space and rehydrate the disc. That's gonna take some of the sting out. And then do some stretches. I mean, stand up. And this may sound really crazy. Hold on with one hand and stand on one leg. See how long you can do that for. I mean, seriously. Now, take your hand away and see how long you can stand on that one leg. You're going to probably notice that one side's more effective than the other. And this is by design. The body gets information from both legs. And if one's weaker, you're going to know about it, because when you go to stand on it, it's just not going to be as strong. So there are stuff you can do at home. Now, if you got questions, again, I'm more than happy to answer it. My office number is 203-656-3636. 203-656-3636. Give me a call. If I can, I'm more than happy to get back. And I'm also more than happy to refer you to somebody in your area. Just because you don't practice near Stamford, Connecticut, or Darien, Norwalk, or New Canaan, Connecticut, doesn't mean you can't be helped. But, there's enough people I know throughout, been practicing for 28 years now, that I know throughout the country, who I could more than happy to refer you to. But interview the person. Tell me, before I make the appointment, I like to talk to the doctor. Now the one thing I got to tell you is, this day and age, you have insurance is basically going away. If you have insurance, you're paying a lot more for it. You have higher deductibles. That's just where it's going. So sometimes people will call us up and say, hey, do you take my insurance? And I have to stop them there, because you're coming to me for solutions, and the insurance is really between you and your insurer, not between me and your insurance company. It just doesn't work that way. So focus on make your health the priority. Now, if you can't afford it, hey, that happens. But I mean, I think there's enough people out there. If you search around, you might be able to find a practitioner who's affordable and deliver what you think you need. But again, if you have any questions, feel free to ask. Dr. Brian McKay, Core Health Darien, the Back Pain Project. Give me a shout, 203-656-3636. We are located at 551 Post Road, Darien, Connecticut. Once again, pleasure speaking to you. Hope you learned. Basically, get off your ass and start moving if you're sitting down excessively. I think you know who you are. All right, I hope this helps. Have a great day. Talk to you soon.